what are my thoughts about transferring a mosaic embryo? I tell people, it's a little complicated, but let's talk about it. And ideally, the mosaic embryo is going to have a single event, like a single chromosomal event. Remember, mosaicism is a combination of cells, some normal, some abnormal. So ideally, it's just occurring on one chromosome and not two. I've done two before. It's not ideal, but that can be done. But you don't want to transfer a complex mosaic embryo. That means there's 3 chromosomes that have a mixture of cells. The other thing that we've seen in our laboratory is that embryos that work better if they're mosaic are embryos that have a low-level mosaic. So, as opposed to a high-level mosaic. So a low-level mosaic, the standard is 20 to 40% of the cells are going to be abnormal. And what that means is 60 to 80% of the cells are quote-unquote normal. So that's where pregnancy rates, sure, they're going to be a little bit lower than transferring a euploid embryo, but they're still reasonable. The other big thing for choosing the embryo is which chromosome. If it's a chromosome that may result in a live birth, let's say like a Down syndrome, an Edwards, a Pato's, a Klinefelter's, then me, John Norian, I just don't feel comfortable with that. Before transferring any mosaic, I do really recommend that everyone speak with a genetic counselor. These are kind people, they have master's degrees in genetics, and they'll really spend more time walking you through it. So I hope that helps. I've preferred low-level single chromosome mosaics as opposed to other events.